Health and hygiene. Health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Disease is any physical or functional change from a normal state that causes discomfort or disability or affects the health of a person. Why does disease develop? A disease can develop due to infection, malfunctioning of any body part, and a badly balanced diet. The types of diseases are congenital, which are present at birth, and acquired, which develop after birth. The congenital diseases examples are hemophilia, thalassemia, color blindness. Acquired disease develops after birth. They are communicable, which are transmitted from person to person, and they're caused by pathogens. Non-communicable diseases are not transmitted from person to person, and they're not caused by pathogens. Diseases caused by bacteria. Cholera is caused by a bacterium called Vibrio cholerae. The symptom of cholera is very, very bad, watery diarrhea. And the patient would say he has diarrhea for about 50 to 60 times a day, then you know that it's cholera. Typhoid is a disease caused by a bacterium called Salmonella typhi. Now, the picture here is that of the inside of the intestines, and these have big, big ulcers in them, and that is caused in typhoid. So the patient would present with stomach pain. He would have a bit of diarrhea in the second and third week of fever, and the most prominent and important manifestation is fever, which is very high grade. Whooping cough. The patient, which would usually be a child, would present with an intractable cough and a whoop at the end of the cough. And that's why it's called whooping cough. And this is caused by a bacteria called Bordetella pertussis. And pertussis is, of course, the other name for whooping cough. Diphtheria is caused by Corynebacterium diphtheriae. Now, what happens is the patient would present with throat pain and fever, and when the doctor examines the throat, there would be a thick membrane or an exudate or a discharge that's at the back of the throat, causing a difficulty in swallowing. What about tetanus? Now, tetanus is a condition which is caused by the toxin of this bacterium called Clostridium tetani. What happens is these Clostridium tetani bacteria are plenty in soil, and it's all around us. And when we get injured, especially with a deep pointed object like a deep stone cut or a knife cut or a deep needle stick injury, and we leave it over there, these bacteria multiply and the toxin is released and causes something called tetanus, which in other words is called lockjaw. It starts with a condition in which the jaws of the patient become very tight and he's not able to open his mouth. And after that, the whole body goes into spasm and becomes very tight. So the patient needs to be admitted, put in the ICU, and they need to be fed by NG drip, and they need to get a lot of muscle relaxants to make them paralyzed so that they'll be able to survive. It's now very rare because everybody knows about TT injection, which is given to prevent this disease. Botulism is caused by Clostridium botulinum bacterium. That is again caused by a toxin, and that the disease itself presents with a rapidly progressive paralysis. The patient first gets paralyzed in his eyes. He sees double, his eyes become droopy, then his throat muscles get affected and he's not able to swallow, and then there's muscular paralysis of the whole body, and it quickly causes death. Therefore, the patient needs immediate treatment. Plague. Plague used to be there in about 1 or 2 centuries ago, but not now. Plague is caused by a bacterium called Yersinia pestis. This is spread by the bite of a rat flea. Not the rat, but the flea on top of the rat. Now, there are different types of plague, and the one that is seen in the picture is called bubonic plague, in which the lymph glands all around the legs and the armpits and the stomach, they all get swollen. And there is another type of plague which is much more serious, in which the patient starts coughing blood and then they die of a pneumonia. This is a condition called leprosy, and we would have seen a lot of beggars on the road without any fingers. They would have a white rash on their body. That rash is not an itchy rash, but they really cannot feel anything on that rash. So that is leprosy, and it's caused by Mycobacterium leprae, which is a bacterium. Tuberculosis is a disease caused by Mycobacterium tuberculosis, which is another bacterium. And the problem is the commonest affected organ is the lung, and the lung has a lot of cavities in it. And it could affect any other part of the body as well, like it could affect the brain, it could affect the intestines as well. Pneumonia is an infection in the lungs, and this is caused by bacteria. It can also be caused by viruses, but mostly bacteria. Diseases caused by viruses. Skin diseases like chickenpox. Chickenpox has nothing to do with a chicken. This is a skin disease caused by a virus called the chickenpox virus or the varicella virus. The patient would present with fever for 2-3 days, and then they start developing these blebs, these little blisters on their body, and after 5 days it starts scabbing. Now the problem is extremely itchy. The patient has itchiness all over and wants to scratch all the time. And after that period, when the scabs start forming, that's when the patient heals. This is a highly contagious disease, so you should not go anywhere near somebody who has chickenpox. Mumps is a condition in which the salivary glands around the neck get swollen and painful, and the patient has fever, and this is caused by mumps virus. Liver. Liver is affected in infections called hepatitis. Hepatic means liver, hepatitis means inflammation in the liver. So these patients would present with tummy pain, vomiting, and yellow discoloration of their eyes and their skin. The brain. The brain gets infected by virus like rabies virus. Now, rabies, everybody knows, is spread by dog bite. Therefore, if you get a dog bite, you need to go and get your rabies vaccine. What happens in rabies is the patient starts developing symptoms about 1 week after the bite and starts throwing convulsions and gets scared of water and later air, and all the muscles in the throat and the body get spasmodic. And it causes a brainstem inflammation, and they go into a spasm and they die. It's a 100% fatal disease. So far, only 2 people have been reported alive after an infection with rabies. The rest are all dead. Influenza. You must have heard of swine flu, the H1N1, which was there many years ago. It was a big pandemic, and it keeps coming once in a while. Swine flu is something like coronavirus. The badly infected people have the entire lungs infected. Bird flu is also pretty common, but it's not as bad and as fatal as swine flu. Both these are influenza viruses. Common cold is also caused by a virus. The patient would just have a cough, cold, and fever. Polio is a disease in which there is paralysis of the legs. Legs become thinned out and obviously cannot be used. This is because of a virus called poliovirus that affects the child when they are very small. AIDS is a bad condition which the immunity drops down to 0, so they get all kinds of infections, starting from bacterial to viral to fungal infections all over the body, and the patient becomes extremely emaciated. It's caused by an HIV virus, or human immunodeficiency virus. Diseases caused by fungi. Ringworm, the skin diseases. These are common. It's because of improper hygiene. This is a ringworm, the picture of a ringworm. There are also itchy rashes on the skin. So ringworm, athlete's foot, and Dobie's itch are examples of skin diseases caused by fungi. The fungi can also affect lungs. Now this causes diseases with Aspergillus mucormycosis. And this is a growth of Aspergillus in a culture medium. The brain can be affected by fungus like Cryptococcus, this especially in immunosuppressed patients, like in AIDS patients. Diseases caused by protozoa include dysentery, caused by entamoeba, causing amoebic dysentery, in which the patient has bloody diarrhea, blood and mucus in their stools. Malaria and sleeping sickness are also examples of protozoal diseases. Diseases caused by worms. Those diseases that affect the bowels, like teniasis, ascariasis, pinworms, and hookworms. Ascaris is a roundworm, and that's the picture that is given here. Worms that affect the lymphatic organs, especially inside the groin area, would block those lymph nodes, causing swelling of the leg. That is called elephantiasis or filariasis, also caused by a worm. This is the picture of a large cyst containing fluid that's caused by the dog tapeworm inside the liver. Tuberculosis. This affects the lungs, the brain, the bone, the liver, the kidneys, the skin, and virtually any part of the body, but the commonly affected one is the lungs. It's caused by a bacterium called Mycobacterium tuberculosis, and it's spread by air droplets. Now, anything affecting the upper airway or the lungs would be spread by air droplets. Safe to say that. It presents with cough because it affects the lungs, and the important thing is that they can cough blood. They have low fever usually in the night, which increases at night. And the patient would not say, I have 1-2 days of fever. He would be saying he has 2 to 3 weeks of fever and weight loss. Those are the symptoms of tuberculosis. So that's what a normal lung looks like. But see the TB lung on the right side, how the TB has eaten away the upper part of the lung, making it white. Typhoid. The intestines are affected, ulcers develop, and it's caused by a bacterium called Salmonella typhi. Now, this is a section of the intestine. It is not the round intestine. This is not the upper surface. It's the inner wall of the intestines affected by these ulcers, and the lymph glands around it get swollen, so the patient has stomach pain and diarrhea, and they have very high fever to the tune of 103 and 104. And if they don't get treated on time, by the 3rd week, they can blow their bowels, they can perforate or it can burst, the bowels can burst, the patient can die. Cholera, the intestines are affected, and it causes severe diarrhea like tap water. It's caused by a bacterium called Vibrio cholerae, and it's spread by contaminated food and water. Safe to say that any disease that causes a bowel infection will be spread by contaminated food and water. It causes several episodes of large volume watery diarrhea, about 60 to 80 times a day, with vomiting. Then the blood pressure drops, and the kidneys fail if they're not treated with fluids on time, and this can cause death. Botulism affects the nerves, and it causes paralysis. And which paralysis? First, the face muscles, the eye muscles get affected, then the throat gets affected, right? And it's caused by a bacterium called Clostridium botulinum. Toxins are in improperly canned food. Therefore, you would notice some cans have it written on it, do not take the can if the can is puffy. That means there's a lot of botulinum toxin in it. So this is also a highly fatal disease that should be treated as an emergency. Diphtheria. In the throat, there's a membrane that is formed in diphtheria. It's spread by air droplets, and the bacterium that causes it's called Corynebacterium diphtheriae, and it causes throat pain, fever, and cough. DPT vaccine in childhood prevents this. And what does it D stand for? The D stands for the diphtheria, P for pertussis, and T for tetanus. Influenza. So it affects the upper airway and it affects the lungs. There are mild influenza cases that just affect the throat and nose and just causes a bit of fever, but the bad cases affect the lungs. Air droplets it's an airborne infection, and the viruses, common ones are H1N1, H3N2, which is bird flu. H1N1 is swine flu. And it causes throat pain, fever, cough, breathing difficulty, and later death. Poliomyelitis affects the legs, and it causes paralysis and thinning. It's not spread by touch, it's spread by contaminated food and water. Though it doesn't cause a diarrhea, this is one disease spread by contaminated food and water that causes paralysis. And the virus is the poliovirus. The oral polio vaccine that is given in childhood prevents it. Nowadays, they prefer to give injectable polio vaccine. for some reasons, but in mass vaccination programs, they give oral polio vaccine. Hepatitis affects the liver and it causes jaundice. Why does it cause jaundice? Because when the liver is damaged, the bilirubin, which is the yellow pigment, does not get detoxified. And that bilirubin rises in the blood, and that is what causes your jaundice. It's spread through contaminated food and water. Now, there are 5 main types of hepatitis viruses, out of which A and E are the ones that are spread by contaminated food and water. B, C, and D are spread through blood transfusions, needle stick injury. If you use somebody else's needle who had a hepatitis B and you use the same needle, then that can cause hepatitis B, C, and D. Symptoms are jaundice, vomiting, tummy pain, and fever. Chickenpox is a terribly itchy skin disease, and you get it with contact with an infected person, air droplets. The virus is a chickenpox virus or varicella, and the symptoms are fever, cough, and rash. This becomes scabs in 5 days. Measles is also got a tiny little dots of rash called macular rash on the body, and it is not itchy. Now, the problem with measles is the patient does not eat. They don't feel like eating or drinking, so they become very emaciated and debilitated, and they develop diarrhea after that and they're very sick. The symptoms are fever, cough, and they develop these white spots on the inside of their cheeks along with the rash. And this is an airborne disease, so it's highly transmissible to others. Ringworm affects the skin, caused by a fungus, spreads by direct contact, and the symptoms are an itchy rash. Scabies also spreads by direct contact, and it affects the skin. It's caused by a mite, a little mite that bites, and the symptoms are itchy rash, especially in the web spaces of the fingers. Conjunctivitis also spreads by direct contact, and it affects the eyes. There's some pus discharge coming up from the eyes. Patient has pain in the eyes and fever. It's caused by bacteria and by viruses. So if they ask you what diseases are caused by direct contact, remember, leprosy can be spread by direct contact, scabies can be spread by direct contact, ringworms, and conjunctivitis. Vector-borne diseases. Malaria. Malaria is caused by a protozoan called Plasmodium. And the vector is a female Anopheles mosquito. Remember, male Anopheles mosquitoes are good creatures. They don't bite us. Remember it as Anna, please, no malaria. Anna, please sounds like Anopheles. And the patient presents with fever with chills, blood cell breakdown. In dengue, the mosquito is called Aedes mosquito, and the virus is a dengue virus. The patient would have fever with chills for about 4 or 5 days, after which he starts having stomach pain and vomiting, and the platelet count. Platelets are a component in blood. Just like your red blood cells, you have platelets, and those platelets are necessary for clotting. So when the platelet count drops, they have a tendency to bleed. Sleeping sickness is caused by a protozoan called trypanosoma, and it's through the bite of a tsetse fly, and the patient goes into a coma and sleeps. Filariasis. It's caused by a roundworm called Wuchereria bancrofti, and is spread by the Culex mosquito. The person has thick swollen legs and hands due to lymph blockage. Remember, file your nails. Woo, that's cute. Filariasis, Wuchereria, Culex mosquito. Mosquito-borne diseases, malaria, dengue, filariasis. Fly-borne diseases, sleeping sickness, amoebic dysentery. Flea-borne diseases are plague, dog-borne, rabies. Plague. It's caused by Yersinia pestis, which is a bacterium, and it's spread by the rat flea. The patient has swollen, painful lymph glands, bloody cough, and later death. Yellow fever is caused by yellow fever virus and spread by the Aedes mosquito. Remember, it's the same mosquito that causes dengue as well. It causes jaundice because the person becomes yellow, fever, and the liver becomes very enlarged and painful, and it causes death eventually. Amoebic dysentery is caused by a protozoan called entamoeba and is spread by house flies. It can also be spread by drinking contaminated food and water, but the vector here in this case is a house fly. Blood and mucus is there in stools, and the patient would have stomach pain. You can remember it by the mnemonic flies amid the discs. That is, flies causing amoebiasis dysentery. Rabies. This is spread by a virus called rhabdovirus, and it's through the saliva of the dog. So if the dog bites, we need to take a rabies vaccine and the immunoglobulin. It causes spasm, hydrophobia, which is you're scared of water because drinking water causes a spasm in the throat. The patient has convulsions, and it's a sure death. How to prevent and control communicable diseases. We use RO or UV water for drinking. We avoid stagnant water collections near our houses where mosquitoes breed. We have to keep our food covered. We must keep our garbage bins covered. We must use our own handkerchief and keep washing your hands with soap and water before eating, and even if you're in contact with another person. Use mosquito repellents when you're going out into the garden. Use vaccination. Non-communicable diseases are nutritional deficiency, organ malfunction, allergies, and bites and stings. Protein energy malnutrition. We have marasmus and kwashiorkor. Marasmus is a condition in which there is both protein and carbohydrate malnutrition, while kwashiorkor has only protein malnutrition. In marasmus, the child is extremely thin and emaciated with dry, wrinkled skin, and they have stunted growth and mental retardation. In kwashiorkor, they would be grossly bloated. They would have a bloated stomach, like a pot belly. Their eyes would be bulging, and they would have swelling all over their body called edema. They also have stunted growth. Vitamin A deficiency causes night blindness and corneal destruction, so they have a white eye. What is night blindness? They would be able to see in the daytime but not be able to see in the night. The sources of vitamin A are yellow fruits like papaya and mango, fish, egg, green leaves. B1 is also called thiamine, and the deficiency causes beriberi. Now, beriberi is an interesting disease because the heart can get affected because the patient could have heart failure, in which the heart does not pump well enough, and so there's fluid collected all over the body. That is one condition. There is another type of beriberi in which the nerves get badly affected. So they'd have burning sensation in their feet, and soon they would have loss of sensation. Vitamin B1 is present in yeast, in whole grains, and in eggs. Vitamin B12. Deficiency causes anemia, in which there is less blood, and memory loss. It's present in meat and fish. Vegetarian diet does not have vitamin B12. Vitamin C deficiency causes scurvy. Scurvy is a condition in which the person would develop blotches all over their body because of easy bruisability, and the gums would be swollen and painful, and they would be bleeding easily when you touch it. Vitamin C is present in lime, in oranges, basically the citrus fruits, and amla. Amla is one of the richest sources of vitamin C. Green leaves also have vitamin C. Broccoli has vitamin C. Pomegranate has vitamin C. Vitamin D deficiency causes rickets. Rickets is a condition that affects childhood when the bones become very soft and they get bent, and therefore the child has bow legs. Vitamin D is present in milk, in cheese, eggs, butter, fish. Our skin makes vitamin D on exposure to sunlight. Vitamin E deficiency causes skin problems and nerve problems. And the sources of vitamin E are milk, fish, and meat. Vitamin K deficiency causes bleeding problems. The patient would have bruisability, very easy bruisability, and they would not stop bleeding. Vitamin K is present in green leafy vegetables, in soya beans. Mineral malnutrition. Calcium. The deficiency of calcium causes rickets, and the mineral source would be milk, eggs, fish, green leafy vegetables. Phosphorus. A deficiency would cause bad teeth and bad bones, and the mineral source would be the same as the above. Iron deficiency causes anemia, and the immunity would be down. The sources are green leaves like spinach, liver, eggs, and meat. Sodium. A deficiency of salt in your blood would cause cramps. And sodium is present in table salt and in seafood like sea fish, prawns. Iodine. The deficiency would cause a goiter, which is a thyroid enlargement. Iodine is present in iodized salt and in seafood. Potassium. A deficiency causes muscular weakness and paralysis. Potassium is present in bananas, in coconut, in milk, and meat. Chlorine. Dehydration and weakness would be the symptoms of a deficiency, and it would be present in salt. What is salt? Sodium chloride. So chlorine would be present in the salt. Fruits and cereals also have chlorine. A child with rickets has bow legs because the bones become soft at the ends and they bend. And this is due to calcium and vitamin D deficiency. Muscle cramps. Sodium deficiency causes muscle cramps. What about muscle weakness and paralysis because of potassium deficiency? Goiter is the swelling of the thyroid gland, which is situated right in front of the neck, and that controls the metabolism of the whole body. Now, what is metabolism? The rate at which your body cellular function happens is called metabolism. So if the metabolism slows down, like your thyroid is not functioning properly, you feel very tired, you tend to gain weight, and every cell in your body functions less than what it's supposed to. Organ malfunction diseases, diabetes, the pancreas does not secrete insulin enough, which is needed for the uptake of glucose by cells. Heart disease, coronary artery disease in which the blood supply to the heart muscle is reduced, causing angina, which is chest pain. Heart attack, when some heart muscle tissue is suddenly deprived of its blood supply, and therefore the oxygen supply, causing death of that tissue, heart failure and death. Cancer, the uncontrolled growth of abnormal cells in the body, causing malignant tumors. Arthritis, osteoarthritis and rheumatoid arthritis, which is essentially a joint disease. Renal disease, kidneys do not filter the waste products efficiently and therefore toxins accumulate. Allergies, hypersensitivity to certain substances like dust.